Hello. In this video, I'm going to talk about the cranial nerves. Now, I've already done one video about the cranial nerves, and there are many ASMR videos that talk about or even demonstrate a cranial nerve examination. And often we do a cranial nerve exam to assess for problems with the nerves that supply the head, the face and the neck. But there's one time in a doctor's career where you do a special kind of cranial nerve exam. And it's not one that you can demonstrate in an ASMR video because it's perhaps a bit of a morbid topic. And it's when you do a neurological exam to confirm that a patient has brain stem death. And the reason why I thought I'd do this topic is because in my last video on the cranial nerves, I talked through all 12 nerves and how you would examine them in a normal situation. But here is a very special kind of examination. So first of all, why would you do a brainstem death neurological exam? Well, there's a definition which I'm going to talk about now, and it's this. In order for a person to be alive, they have to have a capacity for consciousness. And that means they have to be awake and conscious. And they also have to have the capacity to breathe. And if you don't have either of those things, then in legal terms, you are classed as being dead. But there might sometimes be a situation where a patient doesn't have the capacity for consciousness and they don't have the capacity to breathe, but their heart is still beating. And that situation is when they're on a breathing machine, in which the machine is doing the breathing for them. And if you didn't have the machine, the patient would not breathe. But also, we know that having turned all the sedation off, that the patient is still not conscious. And it's usually because of some sort of brain damage from a bleed or from an injury. That means that the parts of the brain that control your ability to be conscious and your ability to breathe have become damaged beyond repair. So what else do we need to do before we do this very special kind of cranial nerve examination? Well, first of all, we have to know that there is an unfixable structural problem with the brain. And we have to rule out all the other causes that might make a person unconscious. So we assess their temperature, And if it's above 34 degrees C, then we are happy that temperature is not the reason why they're unconscious. And then we may do some blood tests and we measure things like the sodium level, the potassium level, and the phosphate level. And again, we may look to see if they're within normal range. For sodium, the normal range is 135 to 145 millimoles per litre. But for the purposes of these tests, we will actually allow a sodium of 115 to 160. And if it's higher or lower than that number, we may try and alter that number to bring it back into range. Again, a normal potassium is anywhere between 3.5 to 5 millimoles per litre, but as long as it's greater than 2, we know that that's okay. We need to be happy that the sugar level is in range and not the cause of them being unconscious. We need to be happy that they're not under the influence of any sedation that may cause them to be unconscious. And usually we have a CT scan that tells us that there's something wrong with the brain that makes us suspect that the patient has suffered a brainstem death. So there's a couple of administrative things we need to think about. You need 2 doctors to perform the test. And in the United Kingdom, they need to both have been doctors for at least 5 years. And one must be a consultant. And the other just has to be a doctor of 5 years registration. And they do a series of tests, which we'll talk through in a moment. And these tests are performed twice, just to make sure that there is absolutely no doubt. So, what's the first test? Well, the first test is one that you may have seen in a normal cranial nerve exam. And that's to test the pupil. And all we do is shine a light in the patient's eyes and look at the pupil. And the pupil will not react if the patient is brainstem dead. And this tests cranial nerves 2 with the output coming from cranial nerve 3. So the pupil constricting will come from cranial nerve 3, but we expect the test to come from cranial nerve 2. Then you might assess the corneal reflex, and here is the eye from a side-on view. And the cornea again, and the pupil. And this round shape here is the cornea. And all you do is take a thin wisp of tissue paper or cotton and just stroke it across the cornea, or tap the cornea. And you would expect that the patient would blink if their brain was functioning. Again, this tests cranial nerve 5, the trigeminal nerve, with the blinking output coming from cranial nerve 7. And then the next test involves, this is an ear, not a very well drawn one, and this is an eye. And what we expect here is if I take a syringe of ice cold water and squirt it into the ear, you would expect in normal circumstances for the eye to move in some direction. And again, that tests cranial nerve 8, which is the acoustic nerve, and the output comes from nerves 3, 4 and 6. The next test involves applying some pressure to just above the eye on the bony part. So here is the eye, and in this instance the eye is closed. And here is the nose, and there is a bony ridge just here. And you place your thumb in there and you press. And if it hurts and they react, this eye should grimace. So again, you're testing nerve 5, the trigeminal nerve, looking for pain, and you're expecting the facial nerve to cause a response. And then you would look in the patient's mouth, and you would get a tongue depressor and place it at the back of the mouth, and that should make them gag. What you're assessing there is assessing the sensation to cranial nerve 9 and the response from cranial nerve 10. And finally, what you do is place a suction catheter down the mouth and trying to see if you can make the patient cough. And again, you're assessing the vagus nerve there, cranial nerve 10, with the output of coughing coming from cranial nerve 10. There's also what's called an apnea test, which is where we, for a short time, take the patient off the breathing machine and see if they make any effort at breathing. I'm not going to talk too much about that test because it's not really a cranial nerve test, but hopefully this demonstrates how the standard cranial nerve test that you see in ASMR videos is sometimes done in a different way for a very different scenario. Now, like I said, these tests are done twice, but once we've completed the first set of tests, the time at which the first set of tests is done is the time at which the patient is declared legally dead, and then the second set of tests are performed. So like I say, this is a bit of a morbid topic, but if you're a medical student or a nurse or a doctor or a healthcare professional, this may be of some help to you to describe the processes that go on. And like I say, it just demonstrates a slightly different cranial nerve exam, and hopefully one you would never see being performed in an ASMR video. Have a great day.